Care Plan Oversite. Okay, before we even get started with this particular part of the video series, do you know what a CPO means? Do you know what Care Plan Oversite means? If you don't know, there is a full article that you can actually download from the CMS website or from Medicare website in order to be able to get and know more about what CPOs are. So, pretty much CPO in a nutshell is this. When physicians are taking care of patients who are homebound, who are under a home health services, we have what we call a care plan oversight. It's a variety of codes, of billing codes that physicians can actually use, and they can actually get paid in order to be able to care for those particular patients. So the physicians are more able to provide better services. A lot of physicians out there, unfortunately, does not even take advantage and actually lose thousands of dollars a year in claims because they don't even know what CPOs are or what care plan oversights are. There's two major reasons why physicians are losing a lot of money. Number one, they don't really know that they can bill for this. They don't even have an idea about it. Their own biller does not even know about it, or their own biller did not even speak to them. Understand that physicians are not medical billers. And if you go ahead and do a survey, and there is a survey out there about physicians, most of the physicians are not knowledgeable of business. That's why nowadays, for most physicians that are going to med school, they actually take business classes or are required to take business classes because, yes, we are here to care for patients, but ultimately, this is also a business and it needs to make sure that we manage it correctly. Just like agencies are not fully aware of all the services that are out there, and we need to surround ourselves with the right type of people, just like with Home Health Success Academy is being able to help your organizations, your company, your team, your liaison should also be there to help the physicians who are referring patients to you and who will be referring patients to you. So number one, they don't know about or how to bill for them, and number two is they have this quick confusion that they don't really understand what it's all about in regards to how much do they bill if it's a initial certification or how much do they bill for recertifications. So just as we've spoken before in other of our videos, we cannot pay physicians, but we can actually help physicians learn techniques in order to be able to keep money that they are actually not billing for. So if you are able to give those wonderful value-based, educational-based marketing materials, you should make one of these regarding CPOs and how to be able to bill them properly. Teach the physicians the variety of different codes that are available, the description on which codes to use for which. Physicians are losing money. A lot of physicians are closing their doors as well because of improper management of their organizations. What you need to do is you need to show them and teach them and make sure you help them keep their doors open. Because if you can do this for a physician, they will also see you of value and they're going to want to keep you around. And how do they keep you around so that they can keep on getting your educational based materials? Well, they're going to make sure they refer patients to you. You help them, they will help you. And in turn, you're going to be able to create an amazing organization, an amazing partnership, an amazing relationship in order to make sure that you are actually keeping your doors open. So when you are marketing to the physicians and you're creating presentations, you want to show them the codes like I said earlier. You want to be able to answer questions on what they need to do in order to bill these possible codes. At the same time as you want to be able to explain to them what are the minor reasons or major reasons that may cause them to be denied. Remember, you need to educate them on every single thing that they may expect, whether it's a good thing or a bad thing. Proper education is the only way we're going to be able to get ourselves to the next level of the business world. CPO, right direction. Okay, in order to help you guys and point you guys to the right direction on how to be able to use this, all you need to do is instruct the physician that if they are going to be submitting any forms out there to be able to bill these possible CPO codes, whether it's a certification or recertification, physicians only really have to fill out what we call the CMS 1500 form. And this is the CMS 1500 form is required for any Part B reimbursements. So once again, these CPOs are Part B reimbursements that can be submitted with a form CMS 1500. Physicians should be aware of the form at least, and if they are not, give them a copy of what it looks like. Now, if you want further instructions on what type of materials to hand out and to give to these physicians, give us a call at Home Health Success Academy, and we're going to be able to give you guys what we use to market home health agencies out there to physicians in regards to CPOs, or what we call Care Plan Oversites. Remember, help them make money and you will get referrals. That is your ultimate job.